Thank you, the President, the colleague, for invitation to be present today the meeting to speak about the folic acid application, topic application as agent active for photoaging chronology. I think so, it's very well known, this vitamin, because folic acid is a very important factor in our body life. It is very important for the health of our skin. It's normal to consider the folic acid as inside the group B, vitamin group B, is named also B9 or vitamin M. It's a natural compound, but there is the possibility to chemical synthesis, and in this way it's possible to find much form of this compound linked to the number of the molecular glutamic acid. If we search in the literature the paper related to activity of this compound in the dermatologic field, we can find many few papers, because the only paper that we can find is related to activity and DNA and RNA repair and protein synthesis. And the second, the facility, the epidermal and dermal cell regeneration, and the particular stimulating fibroblast division and increasing collagen and elastin turnover. Furthermore, provides protect and anti-aging action from ultraviolet damage. And by the replicates and protect DNA, also from antioxidant action. More or less, the principal author of this paper is the Bosca, and published the paper in 2006-2005 year. And this way, the Bosca, in this case not the other author, is the third author that we can find in the literature, not demonstrated the folic acid skin uptake. In fact, demonstrated in this paper that the folic acid absorption into the skin is dose dependent and increase when the cells are irradiated by ultraviolet. And in this way, he concluded that ultraviolet radiation increases the replication factor C subunit 1 gene expression, and by this protein increase the concentration of folic acid inside the fibroblast, not only in dermal but also in the epidermal cell. And in this way it's possible to consider prevention treatment of chronic photoaging sign by this product, because UV radiation carries photoaging by the mitochondrial DNA alteration in a dermal fibroblast. And the folic acid increases the fibroblast turnover and protects the cell from ultraviolet radiation. In this histogram, we can see the study of the Bosca, published in 2005, where the Bosca investigated the activity of the radiation injury after ultraviolet radiation for 7 days, each day in radiation, and compared the activity of the culture cells not irradiated by the culture cells irradiated, but not treated with folic acid, and the culture cell irradiated and treated with folic acid. After 7, 15, and 21 21 days. And it is evident that the folic acid, depending on the concentration, improve the availability of primary human fibroblasts and stimulate their proliferation. This is some picture that published in the Boston, the same paper. Is very clear the activity to protect fibroblasts from apoptosis and the activity, replication activity of the fibroblast and the production of collagen, new collagen fibers. In fact, the author concluded that the glyphosate treated with the folic acid compared to their respective molecules have a more regular shape and the greater reproduction capacity. Also, the folic acid protects itself from ultraviolet damage. In fact, this type of radiation takes the keratinocyte apoptosis, and the folic acid influences the process, stimulating keratinocyte proliferation and the increase of viability of the safety follicle versus control cell after ultraviolet exposure. This histogram is very clear to see the activity on the modulated DNA pair linked with the folic acid concentration. And the author concluded the folic acid protects cells from apoptosis in response to ultraviolet radiation damage, activating this process. The non-nucleotide excision repair is a more important system to repair after physical and chemical injury. In this paper, always from the Boston, the author investigated the capability after radiation therapy to protect from this radiation human fibroblasts after two doses of the radiation, 5GI and 3GI. And the final conclusion of the author is the rate of the repair of the damaged DNA in primary fibroblast radiated with X-rays depends not only on radiation, those both also from action of folic acid, and the repairing action is higher than the cell treated with folate. And the final say, folic acid modulates DNA repair. Starting of this publication, this data, last year, Meschieri collects the Italian dermatology group working in Milan, performed the clinical study, the first clinical study, to investigate the action to protect the skin, keratinocyte skin, from damage after microneedling treatment. The patients applicate the product topical formulation based on folic acid-free form, specific 10-5, pure vitamin M in monodoses, for a period of 15 days, twice a day, after the needling treatment. The study occurred 10 women and treated with microneedling on the face, but in the hard face was applied ascorbic acid and the other part hydrating cream. And checked the activity of the compound by dermoscopy and confocal laser microscopy before the treatment, immediately after 4, after 7, and after 15 days. dermoscopy and laser microscopy assess three levels of the damage inside of the skin: surface, intermediate layer, the papillary dermitic in the dermis activity of the compound. In the overall image surface in the skin assessed the number of holes and the size of the holes. Furthermore, investigated the intensity of border reflectance. In the epidermal layer, border reflectance is the hyperkeratosis activity. In the intermediate layer, show the oneikom and parta reflectance and the suprabasal reflective keratinocytes. In other words, the keratinocyte necrosis, and so the inflammatory cell presence or not. And the deep layer to consider the production of collagen, the collagen fibrillar pattern. This is the data. It's very important to consider that after 4 days there is the statistical significance data, control area versus treatment area, and in this way it's possible to say that prevent tissue degeneration of the epidermis 29% after 4 days and 15% after 7 days versus control. In the same way, it's possible to consider that the activity in hyperkeratosis, activity of the keratinocytes, not significant activity in this item, but in any case, folic acid induced the appearance of internal cycles of keratinocytes, show more regular and physiological proliferation of the epidermis. In the intermediate layer, they also show the suprabasal reflective keratinocytes, the necrosis, keratinocyte necrosis, and in this way, not the statistical significance data, but after 7 days, it's possible to observe the much better result with the area treated with folic acid, inducing cell physiology restoration and the recovery of the large number of the major keratinocytes, and the capability in preventing cell necrosis. Inflammatory cells, no significant data, but probably through the penetration of keratinocyte degeneration there is more or less inflammatory reaction. Very interesting result. In the deep dermis, there is the statistical significant data after 4 days. In this way, the production of collagen increases. In the same way, we can see the increase of collagen matrix. In the author concluded that it induced the increase in collagen reflectance in the apparent follicle treatment. Folic acid treatment showed after 4 days significant increase for all parameters. 20% more, much better than control area. They also put in the paper some picture. In this way, the surface of the skin is possible to observe in the not treated area after 4 days, compare the treated area in the same patient after 4 days, the different number of holes and different reactivity of the skin related to hyperkeratosis. In fact, the author concluded for this picture and the capability of folic acid to prevent tissue degeneration in area with incomplete damage and regenerating epidermis. This is the data in the intermediate layer after 7 days in non-treated area compared to treated area. Green arrow indicated the hyperactive peak. In this way, it's possible to observe the reduction quantity of hyperactive suprabasal keratinocytes. And this picture, the author concluded the folic acid prevent necrosis, restore cell physiology, and the recovery of large number of damaged keratinocytes. In the dermal, deep papillary dermis, we can see before the treatment by the needling, microneedling treatment, after 15 days in the area not treated with the folic acid, and in area treated with the folic acid after 15 days. The author put in the picture the asterisk 2 evidence the much better height of the collagen effectors, and concluded the folic acid promoted and amplified the production of new collagen fiber. In conclusion, it's very important to consider the action of this product because it is clear that folic acid accelerates epidermal repair, promote regular and physiological keratinocyte repair, promote and amplify the production of new collagen fibers, protect keratinocytes from degenerative process and inflammatory reaction caused by trauma. In this way, it's possible take into consideration the application topical situation of the skin as the prevention and the treatment aside from photoaging, treatment of inflammatory skin condition after chemical and mechanical treatment, and finally to protect the protection from skin damage induced by radiation treatment after ultraviolet or X radiation. It's important to take in consideration the activity of this compound combined with other topical vitamin as vitamin A, vitamin E, and vitamin C.